Welcome to our guide on heart palpitations, heart rate regulation, and the causes of heart palpitations. Heart palpitations are sensations of a racing, fluttering, or pounding heart, and they can be alarming even though they are often harmless. Understanding how your heart rate is regulated and what might cause these palpitations is crucial for managing them effectively. In this video, we will delve into the mechanisms that control your heart rate, explore common triggers for heart palpitations, and provide insights into when you should seek medical advice. Stay tuned to learn more about maintaining a healthy heart rhythm and addressing palpitations with confidence. So, what are heart palpitations? Heart palpitations make you feel like your heart is beating too hard or too fast, skipping a beat or fluttering. You might notice these sensations in your chest, throat, or neck. They can be bothersome or scary, but are usually not serious and often go away on their own. Common causes include stress, anxiety, or consuming too much caffeine, nicotine, or alcohol. Pregnancy can also trigger palpitations. If you experience heart palpitations, it's a good idea to see a doctor. Your doctor will review your medical history, do a physical exam, including listening to your heart and lungs, and may order tests to identify the cause. If a cause is found, treatment can help reduce or eliminate the palpitations. If there's no specific cause, lifestyle changes like managing stress can help. Heart palpitations can make your heart feel like it's racing, skipping a beat, flip-flopping, or pounding in your chest and even your neck. Sometimes you might feel dizzy or faint, which could be a sign of a more serious condition. Heart palpitations can have various causes. Sometimes they are related to your heart, but often the cause is unknown. Common, non-heart-related causes include strong emotions, anxiety, fear, or stress can trigger palpitations, especially during panic attacks. Physical activity, vigorous exercise can lead to palpitations. Stimulants, caffeine, nicotine, alcohol, or illegal drugs like cocaine and amphetamines can cause palpitations. Medical conditions, issues like thyroid disease, low blood sugar, anemia, low blood pressure, fever, and dehydration can contribute to palpitations. Hormonal changes, menstruation, pregnancy, or the time before menopause can cause palpitations. During pregnancy, palpitations might also be a sign of anemia. Medications, certain diet pills, decongestants, asthma inhalers, and drugs for arrhythmias or underactive thyroid can lead to palpitations. Supplements, some herbal and nutritional supplements may cause palpitations. Electrolyte imbalance, abnormal levels of electrolytes in your body can trigger palpitations. Some people experience palpitations after eating large meals high in carbohydrates, sugar, or fat. Foods with monosodium glutamate, MSG, nitrates, or high sodium levels can also trigger palpitations. Keeping a food diary can help identify specific food sensitivities. Heart palpitations can occur at night, though you might also have them during the day without noticing. Drinking alcohol before bed or eating a large meal can contribute to nighttime palpitations. To alleviate them, take deep breaths and drink a glass of water, as dehydration can worsen palpitations. You might feel heart palpitations more when lying down, especially on your side. This position can increase pressure on your body, leading to palpitations. Switching to lying on your back may help alleviate them. Can low potassium cause heart palpitations? Yes, low potassium levels can lead to heart palpitations. Reasons for low potassium can include laxative use. Overuse can deplete potassium levels. Too much caffeine. Excessive caffeine intake can lower potassium. Gastrointestinal issues, diarrhea and vomiting from a stomach bug can reduce potassium levels. Undiagnosed thyroid problems. Thyroid issues can affect potassium levels. Heart palpitations can also be related to heart disease and may indicate arrhythmia. Heart conditions that might cause palpitations include prior heart attack, coronary artery disease, heart failure, heart valve problems, heart muscle problems. Now there may be palpitations. During pregnancy also. During pregnancy, your heart works harder to pump extra blood, which can lead to palpitations. These are usually harmless and typically go away after giving birth. To avoid palpitations during pregnancy, stay hydrated. Drink plenty of water as dehydration can worsen palpitations. Limit stimulants. Reduce intake of caffeine, sugar, and fat. Practice relaxation. Try deep breathing exercises. If these measures don't help, consult your doctor about the possibility of taking a beta blocker during pregnancy. Now for diagnosing heart palpitations, the steps your doctor will take includes physical exam, a thorough physical examination, medical history, detailed questions about your medical background, current medications, diet and lifestyle, information about your daily habits and any medicines you take, symptom details, specifics about when, how often, and under what circumstances your palpitations occur. Diagnostic tests includes blood test, can help identify underlying causes, electrocardiogram, EKG, records your heart's electrical signals. It can be done at rest or during exercise, stress EKG, to find unusual heart rhythms. Holter monitoring. You wear a monitor for 24 to 48 hours while doing normal activities to detect rhythm differences not found during an EKG. Event recording. You wear a device and use a handheld gadget to record your heart's electrical signals when symptoms occur. Chest X-ray. Checks for lung changes that might indicate heart problems, such as fluid from heart failure. Echocardiogram, an ultrasound providing detailed information about your heart's structure and function. If necessary, your doctor may refer you to a cardiologist for additional tests or treatment. Even if your ECG is normal, you might still experience heart palpitations. Your doctor may suggest additional tests, like a Holter monitor, to ensure your heart is healthy, especially if you don't have other symptoms such as chest pain. The treatment for heart palpitations depends on their cause. Often palpitations are harmless and resolve on their own, requiring no treatment. However, if your doctor doesn't find a specific cause, they might suggest avoiding potential triggers and managing lifestyle factors, such as managing anxiety and stress. Since anxiety, stress, fear, or panic can trigger palpitations, it's important to manage these emotions. Techniques include relaxation exercises, yoga, tai chi, biofeedback guided imagery, aromatherapy, avoiding certain foods and substances. Some items can trigger palpitations and should be reduced or eliminated, such as alcohol, nicotine, caffeine, illegal drugs. Medication review. Consult your doctor about medications that might cause palpitations you may need to avoid. Cough and cold medicines, certain herbal and nutritional supplements. Now medical treatments includes medications. If lifestyle changes don't help, medications may be prescribed. These could include beta blockers, calcium channel blockers, treating underlying causes. If your doctor identifies a specific cause for your palpitations, treatment will focus on that. Medication adjustment. If a current medication is causing the palpitations, your doctor will look for an alternative. Arrhythmia. If the palpitations are due to an arrhythmia, specific medications or procedures may be necessary. You might also be referred to an electrophysiologist, a specialist in heart rhythm disorders. By addressing both potential triggers and underlying causes, you can effectively manage and reduce heart palpitations. To help alleviate heart palpitations at home, it's essential to adopt some simple strategies. Deep breathing techniques, such as box breathing, can be particularly effective. This involves inhaling for a count of 4, holding your breath for 4, exhaling for 4, and then holding your breath again for 4 counts. Additionally, vagal maneuvers can be beneficial. One method is to tense your muscles and bear down as if you're about to have a bowel movement, which activates the vagus nerve and helps regulate your heart rate. It's also important to limit your intake of caffeine and alcohol, as both can trigger palpitations and cause dehydration, worsening the symptoms. By integrating these techniques and lifestyle adjustments, you can better manage and reduce heart palpitations while working with your doctor to identify and treat any underlying causes. Regular follow-ups with your doctor are crucial when dealing with heart palpitations. Although palpitations are often not serious, they can sometimes be related to more significant issues such as abnormal heart valves, heart rhythm problems, or panic attacks. It's important to notify your doctor if the nature of your palpitations changes or if they suddenly increase in frequency. If you experience dizziness, confusion, lightheadedness, fainting, shortness of breath, or pain, pressure, or tightness in the chest, neck, jaw, arms, or upper back, along with palpitations, call 911 immediately. Thank you for joining us on this comprehensive guide to heart palpitations, heart rate regulation, and their causes. We've explored the sensations of a racing, fluttering, or pounding heart and how understanding these symptoms can help in managing them effectively. Remember, while heart palpitations can be alarming, they are often harmless and can be managed through lifestyle changes and medical guidance. Regular follow-ups with your doctor are crucial. Although palpitations are often not serious, they can sometimes indicate more significant issues such as abnormal heart valves, heart rhythm problems, or panic attacks. If you notice any changes in the nature or frequency of your palpitations, or if you experience symptoms like dizziness, confusion, fainting, shortness of breath, or chest pain, it's vital to seek medical attention immediately. By understanding the causes and implementing these strategies, you can maintain a healthy heart rhythm and address palpitations with confidence. Stay proactive in your health management and don't hesitate to seek medical advice when needed. Please click on the next video for more Live Good info. Thank you very much.